Florida Credit Union has your CD options covered. Florida Credit Union, connecting your money to your life. Call 352-237-8222 for more information. Must act by 1/15/14.
All right, 3 minutes after 11 o'clock. Thank you for tuning in this morning. I guess it was last week or so, we were talking about a Facebook post from, it was an email from somebody that you are friends with, Robin, and the gentleman is up in age. He's in his 80s, and he was sad to report that a friend of his in his 50s had died of a heart attack, like suddenly, just died. And and so he was basically, in his email trying to encourage anybody who would read it and pay attention to it to do whatever you need to do to make sure your heart is healthy, because it'll just stop if you don't take care of it. That's the end of life, right?
Yeah.
Dr. Philip Adamson is on the phone. He is one of the nation's top cardiologists. I'm sure he's seen everything that can possibly go wrong with your heart. It's an honor to have him on our show. He's the founder of the Congestive Heart Failure Treatment Program at the University of Oklahoma Health Sciences Center. He's the director of the Heart Failure Institute, and he established new training programs for heart failure providers. Specifically, I see on my notes here, we're going to talk about the blockage of the heart, or let me try my hand at this word, the symptoms of atrioventricular block. And there's also a new FDA-approved treatment option that he's going to let you know about. Dr. Philip Adamson, again, it's an honor to have you on our show. Good morning, Doctor.
Good morning, Larry. Thank you very much for having me.
You're welcome. Where are you right now?
I'm in Oklahoma City.
Oh, okay. Can I ask you to real quickly explain what congestive heart failure is? What gets congested? The lungs?
The lungs do. Typically, the entire body actually can become congested when the heart fails. Essentially, heart failure is an inability of the heart to meet the body's needs for blood flow for whatever reason, whether it be an electrical problem, a valve problem, or a muscle problem. And that complex disease syndrome then activates a bunch of different things that makes the heart get worse over time. So it's a very systemic disease, affects all the organs in the body, and produces tremendous symptoms and disability in patients who have it.
Oh, really? So, and forgive me if this is a really stupid question, but fluid does not build up in the heart, or am I right?
No, actually, if you think of it as a pump, the blood coming into that pump should be propelled out to the rest of the body or from the body into the lungs. And when the heart can't move that fluid forward, the backline pressures build up, and that causes a tremendous number of problems. Most importantly, if pressures build up high enough, the water can leak out of the blood vessels into the lung tissues itself, and then patients feel like they're drowning. So it's a very serious disorder that can cause people to die. But fortunately, we have a tremendous number of breakthroughs in technology to help patients get better.
The word that I tried my hand at, atrioventricular block, that sounds like something that would cause what we were just talking about with congestive heart failure. Is that right?
Well, it does, and you did a great job pronouncing the word. AV block, or atrioventricular block, means that there's a primary problem with the electrical system of the heart, and it's really amazing. In the heart, the heart has its own specific electrical system. The heartbeat starts in the top chambers of the heart. That then is transmitted through the top chambers, and it's the electricity that makes the heart squeeze and move the blood. So that electrical impulse then is sent in an orderly fashion through special wiring system in the bottom chambers, and that wiring system makes the electricity get to the heart very quickly and allows and makes the heart beat. So the lub-dub sound that you hear when you listen to the heart is created by that electrical system. In heart block, the connection between the top and bottom chambers is broken for whatever reason. If a patient has a heart attack, for example, or if they have other problems with the electrical system, that connection can break. And when that happens, the heart beats very slowly, and patients feel faint, can pass out, or even die. They feel dizzy and feel short of breath as well. So the heart beats so slowly that it can't meet the needs of the body.
Oh, wow. And the information I have says that there is some kind of an approved treatment. So I'm assuming this is new, and this directly helps out with these symptoms?
So for years we've treated this condition with a pacemaker. Pacemakers are computers that are implanted inside the patient's body with a battery on there. Wires are attached to the heart, and those wires can both sense electrical activity and deliver electrical impulses to make sure the heart beats fast enough. So traditionally, we've placed 2 leads in the heart to support the heart rate. In the major breakthrough that we have with the trial called BLOCK-HF, we found that by placing a 3rd lead in that system to the outside part of the heart, that we were able to make the heart get better over time while supporting its heart rate. We also found that patients had a better quality of life, lived longer, and had a reduced need for hospitalizations when we applied this new 3-lead system.
Sometimes people are diagnosed with a leaky valve in their heart, and they're just told that everything will be fine. Should there be some kind of surgery done, or are they really fine?
Well, Robin, it depends. Many valves leak a mild to moderate amount, and they can cause some symptoms. But when that leakage becomes severe, then there's serious abnormalities that can come from that leakage, including a progressive worsening of heart pumping function and worsening of symptoms. So there are times when the valve leakage becomes bad enough that a surgery can be indicated to correct that.
If somebody has had a stent put in and then they get this heart block, are they a different candidate for this treatment, or is it just as likely that they'll get it or not get it, depending on other factors?
Well, many people who have blockages in their heart arteries that require stents have had damage to the heart muscle from that blockage. So the blockage in the artery actually decreases the blood flow to the muscle, and then the muscle becomes damaged. And if that damage occurs right at the right spot, then the electrical system can be damaged as well. So yes, there's a fair number of folks who need stents, and the blockage damages the electrical system. And the BLOCK-HF trial, we studied patients whose heart pump was a little bit weak. It wasn't quite as strong as it should be, and found that this new 3-lead system actually really did a better job of pacing.
So does somebody, when they speak to their doctor, do they refer to it as the 3-lead system, and will their doctor know what they're talking about?
Most doctors will. This is brand new. FDA approved this in mid-April. We completed the trial about a year ago, and the FDA started the review process in October. So this is a new approach, although it's well known, and the pacemaker system has been around a while. So I think most importantly for your listeners is the information that there are different pacing systems that may be appropriate for them if they have a conversation with their doctor about pacemakers.
Would this cause blood clots anywhere else in the body if the heart is malfunctioning?
It can. Certain electrical problems of the heart can cause the blood to kind of swirl in the heart, and blood clots can occur. Certain electrical problems, such as a disease called atrial fibrillation, can cause a blood clot to even break off and go to the brain and cause a stroke. So the electrical system of the heart is so key for our survival and for our well-being. Making sure that that's well treated is very important.
So is the patient able to run and do things? I mean, when we do things that normally increase the speed of our heart, I'm guessing that the brain somehow tells the heart to do that. Does this 3-leaf device do the same thing, or does the brain somehow tell it and then it tells the heart? How does that work?
That's really an outstanding question, and it's amazing how quickly the heart can respond to whatever need we have and whatever we call upon. And you're exactly right. In their normal circumstances, the nervous system tells the heart that we're exercising and we need a faster heartbeat, or we're resting, we need a slower heartbeat. And all of those things happen within milliseconds, responding to your needs for your entire life. So the goal of putting a pacemaker in is to correct the abnormalities of the electrical system of the heart and make it so that we can run or walk or exercise or do the things we want to do. Inside the pacemaker is a system that monitors movement of the body and will adapt the rate that it provides the heart when the device senses that we're exercising. So it's a pretty amazing system. We call it rate responsive system, and that is all built into the computer that's implanted under the skin in the patient.
And the patients who were involved in the study, did the doctors have to fine tune it? I mean, is there a way to say, it's not beating like it should, I got to turn a knob a little bit?
Absolutely. It's a very interesting interface between the doctor and the implanted device. The computer can be reprogrammed from the outside of the body.
Oh, wow.
With a radio frequency interface that allows us to talk to the device. It can tell us what it sees. It memorizes a bunch of stuff over the last months as to how the patient's been doing, if they've had arrhythmias or other problems, how much pacing is occurring, is it pacing properly, and we can tweak those settings remotely even to make sure that the pacing is adapting to what the patient's situation is at the time.
And does heart disease target everyone, or are certain ethnic groups targeted above other groups?
Heart disease is the most common reason why people are disabled or die in the United States. There's regions of the country in which it's the prevalence of heart disease is higher, but everybody is at risk. Everyone should be concerned that we've been given this amazingly engineered, precise machine, and it takes very little maintenance for it to be very healthy for our entire life. So being concerned about how your heart is, how you're treating it, are you doing the things that you would maintain appropriately? And my analogy to patients is, if you had a Ferrari or a magnificent machine like that, you would change the oil every 20 minutes and keep every speck of dust off that car.
Right.
What we've been given in our chest is a million times more complicated and well engineered than a Ferrari, and it doesn't need much maintenance, but it does need some.
Oh, wow. Wonderfully put. Okay, so before we say goodbye, I know that the listeners who want to know more will ask me later on if there's a website or a book or something. So can you help us out with that? Where can they go? Just to their doctor?
Sure.
Or? Yeah.
I think the Block HF trial was published in the New England Journal of Medicine, and their website would be able to provide them with a summary of the trial itself and the results.
Okay.
But I think the most important thing is to be aware that there are pacing systems that are available that may be different than what we've traditionally used and may be more effective for certain patients. And for your listeners to have that understanding and to be able to talk with their doctors about, what kind of system would be appropriate for me. Should I have this 3-lead system? Should I have a traditional pacemaker? And bringing it up is incredibly important for the patient to be their own self-advocate.
All right. Excellent interview, Doctor. In a short period of time, I think you've explained an awful lot. Dr. Philip Adamson, thank you. It's an honor. And for the listeners, call us if you need that information repeated. The interview itself will be has been recorded. It'll be on our Facebook page by 2 o'clock today. Dr. Adamson, thank you for being on the air with us today.
Robin, Larry, thank you for having me.
Good stuff. We'll take a little break. We'll be right back.